Assalamu alaikum dear students. Welcome to Dr. Rumi Lectures. In our previous two sessions, we have studied vitamin K deficiency and hemophilia. Both are bleeding disorders in which secondary hemostasis is affected. Today we are going to study a problem in which primary hemostasis is affected. This is thrombocytopenia. In this case, the platelets level is very low and this can lead to bleeding disorder. What is the normal platelet count? The normal count of platelets is between 150,000 to 450,000 per microliter, which is also called as millimeter cube. So if someone asks you what is the normal level of platelets, please don't be confused. This is between 150,000 to 450,000 per millimeter cube or per microliter. In Pakistan, you can call it between 1.5 lakhs to 4.5 lakhs per millimeter cube. If you express this platelet count into liters, then it will become 150 to 450 into 10 raised to power 9 per liter. In case of thrombocytopenia, this count will be less than 150,000 per microliter. I hope you can recall the three stages of hemostasis, which are vasoconstriction, platelet plug formation, and then blood clotting. So whenever there is trauma to the vessel wall, in order to prevent bleeding from this damaged vessel, the first step will be vasoconstriction, which will decrease its diameter and decrease the blood flow. Hence, hemostasis to some extent can occur. The second step is formation of a platelet plug. I hope you can recall that platelets will attach with the collagen with the help of von Willebrand factor. These will be activated, they will release ADP and thromboxane A2, which will activate even more platelets, which will be aggregated here, and hence a platelet plug will be formed here, and this will stop bleeding. The time required by this platelet plug to stop bleeding is called as bleeding time. The third step is that this platelet plug, it will be strengthened by a stronger clot which is made by fibrin, and the time required for the fibrin clot to form is called as clotting time. What are the clinical features of thrombocytopenia? Platelets are very important to stop bleeding from small vessels like venules and capillaries. Actually, during daily life, thousands of smaller vessels they rupture, and bleeding from those vessels they stop by the action of platelets, which make a platelet plug there. So whenever there will be deficiency of platelets, so small pinpoint hemorrhages can occur in skin and mucous membranes, and these are called as petechial hemorrhages, or we can also call it thrombocytopenic purpura. Moreover, mucosal bleeding can occur. For example, there is increased risk of bleeding from the nose and also from gums. In females, heavy menstrual bleeding can occur, and also at the time of delivery, there is increased risk of bleeding. So when you get the lab investigations done, platelet count will be low in this case, less than 150,000 per microliter, and the clotting time will be normal, but the bleeding time will be low, because bleeding time depends upon the number and function of platelets. Because platelet level will be low, hence bleeding time will be increased or prolonged. Although levels less than 150,000 per microliter are called as thrombocytopenia. However, spontaneous bleeding usually does not occur until the blood levels of thrombocytes are less than 30,000 per microliter. So when the levels are less than 30,000 per microliter, this increases the risk of severe bleeding after surgery and trauma. Moreover, the levels which are less than 10,000 per microliter can be really very fatal. Which clotting factor is important for clot retraction? This is fibrin stabilizing factor, which is also produced from platelets. Hence, when the platelets are low, the production of clotting factor number 13, which is fibrin stabilizing factor, will also be low, and hence clot fails to retract. Let's talk about the causes of thrombocytopenia. One important cause of thrombocytopenia is decreased production of platelets from bone marrow. So the production of platelets from bone marrow can be decreased when some nutrients are low, like in case of folic acid deficiency, vitamin B12 deficiency. It can also be low in case of some infections. For example, HIV and some other infections can suppress the production of platelets from the bone marrow. And this platelet production from the bone marrow can also be low when bone marrow is suppressed by chemotherapy or radiotherapy. So in such cases, when there is aplastic anemia going on, the platelets will be low, red blood cells will be low, and white blood cells will also be low, and this is called as pancytopenia, which means all the blood cells in peripheral circulation will be low. Another important cause of decrease in platelets may be increased destruction of platelets. So platelets may be destroyed when there are antibodies against platelets, for example, after blood transfusion. So there may be increased destruction of platelets when there are antibodies which are formed against platelets, for example, after blood transfusion, or when there are autoantibodies produced in our body, for example, in case of some autoimmune disease like in systemic lupus erythematosus SLE, or when some antibodies are formed against platelets after some drugs are given, for example, heparin induced thrombocytopenia. So such platelets which are coated by antibodies, they are more likely to be destroyed when they pass through spleen. Another important cause of platelet deficiency is pooling or sequestration of platelets in spleen. As you know that red blood cells, they are destroyed in spleen, and just like that platelets are also destroyed in spleen. So whenever spleen becomes bigger in size, for example in case of liver failure, or when there is portal hypertension going on, for example in case of cirrhosis of liver, spleen becomes bigger in size, it removes more platelets along with other blood cells, and hence because of more pooling or sequestration of platelets within the spleen, their level in peripheral circulation decreases. Sometimes platelet level can also be decreased if platelets are consumed in thrombi, for example in disseminated intravascular coagulation, which can occur in case of sepsis or when there is some severe trauma going on within the body. Then platelets will be used up in the body and this will decrease the count. Hemodilution of blood can be another cause for platelet deficiency. For example, when someone is given massive blood transfusion, it can dilute our blood. So actual count of platelet does not decreases, but relatively it becomes less because plasma volume becomes more and platelets are diluted. We can memorize the causes of platelet deficiency by this mnemonic, which is platelets. So in this platelets, the first P is for platelet disorder. For example, idiopathic thrombocytopenia, which is also called as immune thrombocytopenia. In this case, the cause is not known in many people, and there is formation of antibodies against the platelets which destroy them. Here L stands for leukemia. So when there are leukemia or some myelodysplastic disorders, not only the platelet production but also the red blood cell and white blood cell production will be decreased. In aplastic anemia, which may be caused by chemotherapy or radiotherapy destroying the bone marrow, it will also cause pancytopenia, a decrease in the count of all the blood cells in peripheral circulation. Sometimes after severe trauma, there may be formation of thrombi throughout the body, which is called as disseminated intravascular coagulation, and the platelets will be used up in that case, leading to thrombocytopenia. So when spleen size is enlarged in case of portal hypertension, for example in case of cirrhosis of liver, the size of spleen will become bigger and it will remove more platelets because of sequestration or pooling from the blood, and in this way the thrombocytopenia will occur. So liver disease may be another cause because it can increase pressure in the portal veins and hence leading to increased sequestration or pooling of platelets within the spleen. Ethanol or alcohol, when chronically consumed, it can cause damage to the liver and then cirrhosis of liver, which can cause portal hypertension and then sequestration of platelets within the spleen. And also it can cause folic acid deficiency, which can decrease the production of platelets from bone marrow. Some toxins and drugs, for example, chemotherapy, and also heparin can decrease the platelets. In case of heparin, this is antibodies which are produced against heparin. So this is called as heparin-induced thrombocytopenia. So those antibodies then attack the platelets, and then these platelets which are coated by antibodies which are formed against heparin, these are destroyed in the spleen. And sometimes in case of severe infection going on throughout the body, there is formation of multiple small clots throughout the body, which is called as disseminated intravascular coagulation. So in such a case, just like in trauma, when DSC occurs, the platelets may be consumed. So this consumption coagulopathy, it will lead to thrombocytopenia or decrease in the count of platelets. So at one time, there is clot formation, which is going on throughout the body at several points. And because of decrease in the number of platelets because they are consumed, the risk of bleeding also is increased because of thrombocytopenia. So at one time there is clot formation going on in the body, and because of use up of the platelets, there is increased risk of bleeding as well. So what is the treatment of thrombocytopenia? It depends upon the cause. So treatment may differ in case of different causes of thrombocytopenia, but usually fresh whole blood transfusion is required, which contains large number of platelets, and this may improve the condition of the patient. In some cases, for example, in case of immune thrombocytopenic purpura, removing the spleen may be very useful because this is the spleen which removes platelets, and hence when we remove spleen, that is in case of splenectomy, the destruction of platelets will be decreased, and this can improve the condition of the patient, and sometimes this can lead to cure of the disease. Moreover, in case of immune thrombocytopenic purpura, Steroids may also be used because steroids are immunosuppressive drugs. So by suppressing the immunity, they decrease the formation of antibodies against platelets, and hence the destruction of platelets will be decreased. So far, we have studied three important bleeding disorders: vitamin K deficiency, hemophilia, and thrombocytopenia. In our next session, we will study thromboembolic conditions in which the risk of clot formation is increased. Thank you so much for watching this video. See you next time with another video.